EAACI, the European Academy of Allergy and Clinical Immunology podcast.
Hello and welcome, listeners, to another episode of the EAACI podcast and the last one before our upcoming Congress. I am Mohamed Shamji, Vice President of Congresses, and today we have a special guest joining us, Dr. Abul Abbas, the Director of the upcoming Immunology Update, Selected Topics in Basic and Translational Immunology course at the EAACI Annual Congress 2024 in Valencia, Spain. Dr. Abbas, it's an honor to have you with us.
Thank you, Mo. It's a real pleasure to be here.
Dr. Abbas, before we dive into the detail of the course, could you share a bit about the background and the expertise in the field of immunology for our listeners?
Of course. I received my medical degree in India and then came to the US to pursue my training in pathology at Harvard and the Brigham and Women's Hospital. I became a professor at Harvard Medical School and head of the Immunology Research Division at the Brigham. My research interests primarily revolve around understanding immune responses and mechanisms of autoimmune disease. In 1999, I took on the challenge of accepting chairman of the Department of Pathology at the University of California in San Francisco, and I've continued my research, I did continue my research at UCSF. I've published a lot of papers, but perhaps most relevant to this course, I've taught immunology at many academic institutions and organized immunology courses, both academic institutions and biotech and pharma companies throughout the world.
Your contribution to the field are truly impressive, Dr. Abbas. Now let's shift our focus to the upcoming course you're directing. Can you tell us more about the Immunology Update course and what participants can expect from it?
Sure. The rationale for a course like this is that immunology is a fast-moving field, and there are lots of changes and lots of information. And for people, basic scientists doing research, as well as clinicians looking after patients and doing laboratory work, it's difficult to keep up with all that's happening in the field. So this update course provides a review of selected topics in basic immunology, especially the ones where there have been important recent advances and that raise issues that are relevant to the pathogenesis and therapy of immunological diseases. This course caters to clinicians, trainees, postdocs, and graduate students, and scientists in biotech and pharma companies who are involved in developing therapies for immunological diseases. So it's really designed for a quite broad audience.
That sounds like a valuable opportunity for professionals across various sectors. Could you elaborate on some of the key topics that will be covered during the course?
Yes. The emphasis will remain on basic mechanisms of immune responses, but throughout we will try to delve into advances in basic immunology that are relevant to human diseases, including autoimmune and allergic disorders. We'll explore fundamental mechanisms underlying immunological diseases and discuss how one can therapeutically modulate the immune system. We'll go into the mechanisms of action of different immune modulators and spend some time talking about what works and doesn't work. I'll also try to highlight some of the new technologies that have come into our field that are making a big difference in understanding immunological diseases.
That sounds really interesting and fascinating. I'd like to explore some more aspects of the course, if you would allow us. Could you elaborate on the specific format of the course sessions and how participants will engage with materials?
Sure. In order to cover such a broad range of topics, we organized the course into a series of lectures with PowerPoint presentations. But I try to design the lectures to be as interactive as possible. So throughout the talks, we'll pause for questions. I will try to challenge the audience, and hopefully, the audience will challenge me. And we'll try and make this as much of a dialogue as possible rather than me just speaking. So it's really basically a lecture oriented, lecture focused course, but hopefully a very interactive set of lectures.
This sounds really like a dynamic and engaging learning experience. And this is really, I mean, the way that we've been teaching at a university or at faculty level has always changed, where we bring more interactive approach. And it's really wonderful to see you bring this at the EAACI Congress. I'm sure our listeners would be interested to know if there are any prerequisites for attending the course. Are there any specific qualifications or level of expertise that participants should have or should try to attain?
Well, we try to accommodate a broad range of participants, including practicing clinicians, trainees, scientists working in companies. I think a basic understanding of immunology would certainly be beneficial, but I also appreciate that anybody who studied immunology in medical school or graduate school more than 10 years ago has lost touch with some of the exciting new advances. So I realize that most people's immunology is a few years old, and we will try our best to introduce them to the exciting new advances that have happened in the field.
That sounds amazing and very reassuring to hear, Dr. Abbas. Now, considering the diverse background of participants, how do you ensure the course content remains accessible and relevant for everyone attending?
One of the strengths of our course is to bridge the gap between basic science and clinical practice. That's what I'm personally specifically interested in. I'm trained in medicine, but I didn't see patients and I focused on basic research in my own lab. So my goal has always been to try and bridge basic science and clinical medicine. And that's what we are going to try and do throughout this course. I will try and present new concepts and new advances as clearly and concisely as possible, but also provide examples where these concepts can be applied in a real life situation.
That approach sounds incredibly inclusive and also effective. As we near the end of our conversation, I'd like to ask about the broader impact of the Immunology Update course. How do you envision this course contributing to advancements in the field of immunology and ultimately improving patient care, and particularly in a congress that's focused in allergy?
Yeah, that's a very good question. People often ask me, what's the purpose of a course like this? And yes, in part it is to bring people up to date, but all of us realize that whatever we do is based on our platform of knowledge. What you do depends on what you know. And this is true in basic science, whether you're working in a research environment, or it's true in clinical medicine. Understanding how therapies work is, in my opinion, the key to effectively using therapies. So I think I emphasize to students, it's not good enough to say we will use anti-IL-5 to treat the disease. You should know what IL-5 does, and you should know how you can use it. And you should then understand what the possible pitfalls are. So I think a course like this provides one with the fundamental knowledge to be able to use therapies effectively. also to study human disease. I think that the study of human disease has changed dramatically. In the past, we could do very little with people. Now we can do more and more. So, how do you study human disease, and what are the questions you should be asking? We won't address all of this in the course, but my hope is that we will open the minds of the attendees so they themselves will be able to address these questions in their own careers and in their own work.
It sounds like a rich and learning experience with a focus on both theoretical knowledge and practical applications. For our listeners who might be interested in attending, could you share the details of the course, such as the date, time, and location?
The course is of the day that the EAACI Congress starts in Valencia. That's May 31st, 2024, from 1:15 p.m. to 6 p.m. And I think that I'm looking forward to seeing a lot of people attend the course. The last time we did this was some years ago in Lisbon, and it was really exciting and actually for me a lot of fun because the audience asked challenging questions and we had wonderful discussions throughout.
Well, thank you for providing those details. Before we conclude, is there any final message you'd like to share with our listeners regarding the course or the field of immunology in general?
Yeah, I think I would encourage people interested in immunology and in updating their knowledge to come to a course like this. It's short, but it will be fairly comprehensive, and we can address a lot of important and interesting questions. As all of us in the field understand, immunology is at the crux of many human diseases. And I do think it's important for practitioners as well as scientists to keep abreast of the recent advances in the field. So I'd encourage people who are interested in immunology to attend the course.
Wise words indeed, Dr. Abbas. Thank you once again for joining us today and shedding light on the Immunology Update course. For me, this event, you joining us today, it's been truly a privilege, an honor, and I have been following your book. I've been reading immunology since during my undergrad. I used the textbook for my postgrad, and even now I do refer to it every now and then. To our listeners, make sure to mark your calendars for the enlightening event at the EAACI Congress in Valencia, Spain, and secure your spot by registering. See you soon, and follow us all on social media channels and stay updated about all EAACI news.
All EAACI's podcast episodes will be available on Apple Podcast, Spotify, Google Podcast, and YouTube. See you on the next episode. EAACI, the European Academy of Allergy and Clinical Immunology podcast.